How do you envision a truly equal healthcare system for women in the future?
Just access to care. We don't need anything special, other than access to specialists that are specialized in women's care, because we certainly don't have the same internal organs as men. I mean, we do have lots of the same, but many of the things that make us women are different than a man. So, we should be able to have access to professionals that can take care of all of our, not just box us in. I think it's kind of funny because my mom I guess she kind of complained a bit about her hot flashes, but that was basically it, But there was no care for women that were going through perimenopause. But my generation is not going to tolerate this. And I've told my daughter, I said, we will have had it figured out by the time you get this age and you start experiencing these symptoms, because the bone pain and the insomnia, it's insane. And, you would think by now in 2025 that we would have a system that would take care of us through our lifespan. But right now we are in a time where my age and older are fighting for equitable care that will help, like hormone therapy, access to hormone therapy when we go through menopause. Like it prevents dementia and Alzheimer's and severe osteoporosis. And there's just so many things that, impact just from those hormones. But not to mention, doing the opposite of adolescence. Now, you're losing those hormones, but your body doesn't really know what to do with it. So, having care through the lifespan to me is number one. And that is having healthcare providers that are interested and doing the work.